At syempre po, nakikiisa ang NET25 at ASPN sa paggunita po ng World Hepatitis Day. Dapat natin pag-usapan kasi nakababahala po yung statistics. Yung sinasabi na noong 2022, meron tayong mga 6.1 million hepatitis cases. Ang dami, di ba? Of which, 1,045 Filipinos ang namatay dahil sa viral hepatitis, di ba? Nakamamatay. So, mahalaga po na pag-usapan natin. So, maalamin po natin ngayong umaga kung ano yung iba't ibang klase ng hepatitis.
No? So, ayan po, kailangan po natin na patuloy ang kampanya po tungkol sa sakit na ito sa layuning mabawasan nga po ang viral hepatitis cases sa ating bansa. Pagsapit po ng 2030, ito po ay ayon sa World Health Organization at sa Hepatology Society of the Philippines. Alamin natin ngayong umaga ang pagkakaiba ng mga sintomas ng hepatitis. Ayan, lahat na ng alpabeta, A, B, C, D, E, abakada E. Kasama po si Dr. Celina Adraneda. Siya po ay isang gastroenterologist mula syempre sa ating paboritong Los Santos Medical Center. Si Doc Celina po ay isa sa Board of Directors po ng Hepatology Society of the Philippines.
She's also a fellow in the Philippines College of Physicians at fellow in the Philippine Society of Gastroenterology and Philippine Society of Digestive Endoscopy. Grabe, hindi just, hindi basta-basta. Good morning. Welcome to ASPN, Dr. Celina.
Good morning, ho. No? Thank you very much for having me here, Miss Pat and Miss Ali.
Our pleasure to have you.
Thank you very much po.
Ito na, malaman natin ang hepatitis, viral hepatitis. Ibig sabihin, kakahawa, no?
Yes, yes.
Ano ang organ na affected? Pag kasi naririnig natin hepatitis, ano yung organ na affected at bakit mahalaga? Bakit mahalagang mapanatiling malusog yung organ na yan?
Okay, no? So, ang hepatitis ho, no, it is a disease that affects the liver. Yung atin hong atay. So, yan ho yung pinaka-affected when you have hepatitis. So, to answer your question, Miss Ali, no, ano ang importance? What is the importance or the function of the liver? Ang function ho ng liver natin, number one, detoxification. So, ang ginagawa ho ng atay, sinasala ho niya yung dugo coming from the stomach, coming from the intestine, dinidetoxify niya. So, number one. Number two ho, it also function as parang regulation ng amino acid na tinatawag. Amino acid is a protein, parang building blocks of your protein. So, pagka ho may problema ho yung ating amino acid or yung proteins, pati ho immune system pumapangit. Nagiging prone to infection tayo, nagiging prone tayo sa mga pneumonia, sa sakit. So, that's how important the liver is. Number three, siguro yung pinaka-importante is yung production of bile. Yun ho yung mapait sa abdo. Yung sa isda, di ba? May mapait sa abdo. So, bile is also excreted or produced in the liver, and its importance is, ang bile ho, siya ho yung nagme-metabolize or nagbe-breakdown ng fats. Everything that you're eating, lahat ng kinakain, inaano yan, parang mine-metabolize yan ng bile. So, that's how important. One of the few functions of the liver.
Isa-isahin po natin yung mga pinagmumulan po ng mga sintomas itong hepatitis. Iba-iba. A, B, C, D, E. Sana tumigil na sa E kasi 5 klase na pala ang hepatitis. No? So, how does it start? How do, and then, the difference.
Iba-iba ba yun?
Between A, B, C, D, E. Sige po, doktora.
Siguro ho, let's start with the general idea, no? Once na you have hepatitis, ang nangyayari ho, nagkakaroon ng paninilaw. Isa nagkakapaninilaw ng mata, paninilaw ng katawan, ng skin. Sometimes, patients would present with flu-like symptoms. Para ho silang nilalagnat. Sumasakit yung kasukasuan, tapos minsan ayaw nilang kumain, nagkaka-anorexia. One of the few symptoms of hepatitis. Worst part of hepatitis would be yung lumalaki yung tiyan, nagkakaroon ng ascites, or yung iba nagmamanas yung buong katawan. So, those are the symptoms of hepatitis. Meron naman hong mga instances which is the most difficult to diagnose. Yung mga asymptomatic na tinatawag.
Walang sintomas.
Walking hepatitis, normal sila, walang nararamdaman. Yan yung pinakamabilis makahawa. Walang sign. So that's why it's a difficult disease to treat. Yeah, it's a very difficult disease.
So what's the difference between the A, B, C, D, E?
Okay, so yung difference niya will be the route of infection.
Okay.
Okay, so start tayo sa hepatitis A.
Kung
Hepatitis
paano ka mahahawahan.
Yes,
Okay.
kung paano mo makukuha yung infection. So yung hepatitis A tinatawag natin yan na fecal oral route. Sa dumi, sa pagkain.
Yeah.
So,
Contaminated food.
Contamination, yes.
Water.
So usually ito yung mga chef, yung mga nagluluto. Tapos may hepatitis A sila.
Yeah.
Tapos they go to the toilet
Yeah,
and then
they won't wash
kulang yung
properly.
hygiene,
Yeah.
they prepare your food. So tayong kumakain, kaya makukuha natin yung infection in that way.
Okay.
So street food, very common yan, Miss
Yeah, sa
Ali.
street food.
Very common, yeah. Hepatitis B naman, this is blood-borne, no? So body fluid. For example, body tattoos, pwede. IV injection. mga-
Body fluids.
Body fluid, yan. Isa yan sa mga route of infection for hepatitis B.
Blood. Tapos
Blood,
yung mga
body
vaginal
fluid.
discharge mo,
Vaginal
semen.
discharge. Yes, so
yung
lahat yan.
saliva mo sa dentista.
Pwede rin, especially yung mga gamit. For
Yeah.
example,
Hindi
na
malinis.
hindi ganun kaganda
Hindi
yung sterilization.
sterilized.
Yes, anything that will be in contact with blood and a wound. Similar with C.
C, same rin.
So same rin. Pero kasi based on studies, ang hepatitis C, mas common siya dun sa mga IV drug users. So yung mga sharing needles, for example, you're using drugs, tapos you're sharing needles with each other, then yun, common hepatitis C.
Ayun. Yung mga sa gluta-gluta drip, kaya.
Pwede, it can be a route of
Kasi
infection.
meron ng di ba?
Yeah,
Pag
pwede.
papa-home service ka, yung mga nagpapa-home service, mga gluta-gluta drip, dapat yung mga disposable, di ba?
Kailangan bago yung
Yeah,
gagamitin na
yeah,
needle.
yeah.
It cannot be shared
Disposables.
from
Yeah.
each other. Also, for example, you've been transfused with blood before the year 1992.
Okay.
So it is also a risk factor. So
Because?
kailangan i-check. Before 1992, the screening for hepatitis in blood transfusion hindi pa ganun kaganda. So if you were transfused before
Tagal nun.
1992,
Yeah,
magpa-check ka.
1992.
You need to be checked.
Need to be checked.
Yes.
Mother to unborn
Okay,
child. Pwede
so
ba yan?
that is also one of the most common routes of infection. So kunwari si mommy positive for hepatitis B infection, pag nanganak siya pwede.
sure.
Malaki yung
Malamang.
percentage. Mas malamang na mata-transfer na yun sa baby. So the letter D, it rides with hepatitis B. So without the hepatitis B, hindi ka magkakaroon ng
Ng D.
Ang D.
Yeah, so it's
Okay.
not so common.
Yeah.
Medyo mahirap din siya i-diagnose.
Okay.
Hepatitis E naman, this is for pregnant patients. So the route is similar with A, which is fecal oral route,
Yeah.
but it is more common in pregnant patients.
Okay.